I thought I was going to be a family doctor for 30, 35 years in the same practice. And it only took me a year before I realized I wasn't having the impact I had hoped. I was seeing patients who had healthcare conditions that really, if they were able to make more healthy decisions, if they were able to have healthier thoughts, that they would be much better off. And when I finished my residency training, it was during the HMO era, and we were seeing patients every 15 minutes. And in order for me to assist my patients in rethinking the way they're going through their day and help them build skills to make healthier decisions and have healthier thoughts, I was going to need a lot more than 15 minutes. So Dan, it certainly was not the path I had set out to take, but that experience and that first year seeing patients full time had me step back and rethink where I was headed.
Yes. So you wanted to have a bigger impact. We don't want to have a conversation about medicine because it's, it feels like it's a mess these days. And our son is a
Yeah.
PA, so
Okay.
and just was promoted to the chief of the PA program or whatever. I
That's
forget the
great.
title, but so he's going to do a combination of management and patient care.
Yes.
Uh, but it's so much of symptom treatment, like you're saying,
Hmm.
and not so much about wellness and health. What got you interested in wellness and health? Was it the fact that you were treating symptoms all the time, or?
Well, it's actually when I went to college, I was pretty sure I wanted to go to medical school, but I didn't want to study biology. At that time, the biology curriculum was about studying, plants and dissecting frogs and worms, and I was having a hard time making the connection to me. And so I actually majored in nutritional sciences. And so fast forward to that first year of practice, I couldn't help but think that this patient wouldn't be having diabetes if they were able to make healthier choices, and this patient's blood pressure would probably be lower if they knew how to read a nutrition label to make that connection to sodium. And so that's really what helped me reset my mind was my nutrition curriculum. And I feel so fortunate to have studied that because it was more than just about food. It was about ecosystems and the psychology of food and the people we're around and how they impact our food choices. So it was a much more robust curriculum other than an apple a day keeps the doctor away.
Mhm. Well, who it really has been influential in your leadership? When you think of your journey and the kind of leader you are today, there have been people along the way, perhaps surprising people sometimes, I'm not sure, who had a big impact on your trajectory.
There have been a lot of people that I'm grateful for influencing my trajectory. I would say outside of my parents, I would say the first person who influenced my leadership in healthcare was Dr. Israel Alvarez back in Buffalo, New York. I was cutting lawns during high school, and the last day of cutting his family's lawn before going to college, he asked me what my plans were, and I told him I was going to study to try to get into medical school. And he invited me to come meet him over winter break. I did not realize he was a doctor, and I did not realize he was the head of the emergency room at our Veterans Administration Hospital in Buffalo, New York. And it was through that that he gave me an opportunity to volunteer, and from there I was on a roll. Now, fast forward, uh, I was working at Blue Cross Blue Shield here in Maryland, and my boss at that time gave me a wonderful opportunity to go to the Center for Creative Leadership
Mm.
in North Carolina, where I spent a 1 week immersion program. And that had an amazing impact on my leadership skills and my thinking about leadership.
How has your thinking evolved over time from, those beginning days to
Yeah.
today?
Oh yeah. I mean, and it continues to evolve. One of the things I love about my job and love about where I work is that learning is part of my everyday. So when I was a much younger leader, um, I looked at it as much more like nuts and bolts. And over the course of time, I've come to understand that it's a real art form that complements the science behind it, and that your leadership styles need to fluctuate and accommodate the different people that you're leading. And I've been very fortunate to grow myself by learning better leadership practices.
Mm. What's important to you now as a leader when you think about the practice side of things? Now,
Yeah.
we could talk about, like Warren Bennis said, leadership is a matter of becoming yourself.
Mhm.
And so there's the personal side. But when you think of the practical side of leadership,
The practical side for me at this point of my career is that it's very important for me that I'm supporting the people on our team in whatever way they need support. I know what my career has done to my health and well-being. Sometimes it's been good, and often, too often, I've allowed it to negatively impact my health and well-being. And so I want to be the boss that the people on my team want me to be, and that means bringing a lot more well-being into our day-to-day practices.
when you think about those transitions in your own journey, when being a leader wasn't necessarily healthy for you, right?
Yeah,
Lots of
yeah,
time pressure, lots of
yeah,
stress.
yeah.
How did you learn to manage that?
Yeah, I often felt like I had two jobs throughout my career. It was the job I was currently doing and the job I was working toward. And that wasn't the healthiest, you know, way to go. But nonetheless, that's behind me. But what I learned at this point is that I wish I had had more confidence in the results that I was bringing to the table. Obviously, I had great results, or I wouldn't be in the position I'm in today. And yet, that confidence level caused me to feel stressed myself.
Mm.
And more likely, it wasn't the stress from others on me. It was really internally driven. I'm still working on this, Dan. I still have some of my own well-being journey remaining.
I hear you. So the loud inner critic, the imposter syndrome, that chatter in the head that is
Yeah.
so accusatory. How have you been navigating that more recently?
Uh, the imposter syndrome came up when I was 34 and I was the medical director of prevention at Care First Blue Cross Blue Shield. And fortunately, I was able to get some help from our institution on that. I actually don't feel consciously imposter syndrome any longer. I more often sometimes question, am I bringing enough value to our workforce? It's no longer the leaders above me that I'm concerned about what their thoughts are about the work I'm doing and the value I'm bringing. I'm more often thinking about, is there some other way that I can be supporting our workforce?
Mm. What have you learned about managing your schedule and time?
Oh, I'm much better at saying no. So Dan, leadership's really important part of well-being, and it's not just the being a good leader, as someone might learn getting their MBA. There's a lot of specific ways we can lead and help support well-being. We actually created a series called 10-minute well-being tips for managers. There's 46 episodes, and one of those episodes is about setting priorities. And so setting priorities really influences not only our own well-being, but the people that we work with. And so I have gotten much better about saying no and sticking with the goals and priorities that we set out.
So I've heard two things when we think about some of the things that are going on for you. One was
Yeah.
you are less worried about the people over you and more
Hmm.
worried about the people you're serving.
Yes.
And then the other is you're learning about priorities, which enables
Yes.
you to say no to the to good things so you can
Yes.
say yes to better things.
Yes.
I like threes. What else
Yeah.
comes to mind for like managing time and schedule for you?
I block out time every morning on my calendar. I've been doing that for probably a couple of years now, 2 hours. And most of the time, I'm able to hold that time because I start on the earlier side. And I use those 2 hours to work on writing or reviewing documents or whatever other projects that I have that are requiring some focus time.
Hmm.
And I leave my email closed. I turn off my phone, and that's been a really valuable way to start my day.
Yes, you're taking some of those best hours and giving them to something. I like to call it the big rocks. I'll
Hmm.
ask leaders, what are
Yeah,
the big rocks on your
yeah,
calendar? I'm not talking day to day. I'm not talking, the next phone call that comes in. I'm talking about something you put on your calendar that goes beyond that, that reflects your values and where you're taking yourself and, all, those kind of things. I'll tell you another thing I've done, and that is 50-minute hours. I do not do back to back. You know what I mean? You
yes.
have to
We
get off of that.
we actually practice the same. One of the six well-being culture building blocks that we subscribe to is norms, the expected behaviors. And we intentionally shape healthy norms, so we only schedule 50-minute meetings with our team.
Mm, okay. Well, I'm so glad to hear that because I've been
Yeah,
preaching this for a long
yeah.
time, and it's like I'll say they should back-to-back meetings should be illegal. They should be like against the law. It shouldn't be allowed, right? Can't you?
Everybody needs a break,
Uh,
and we don't need to create excess stress by running from one thing to another. And sorry, Dan, I have one more thing to say about this because I also it drives me crazy. The longer we make meetings, the more things people will find to discuss without necessarily adding to the outcome.
Yes, yes, yeah. Oh my goodness. So I don't know why. For me, meetings is such a hot topic, but nobody really wants to write a lot of books, or publish books about meetings. It's sort of it's not very,
Yes.
not. But it's like, oh my word. I mean, I work with leaders. They get up in the morning and from like 7:30 to 6:30, they have meetings back. They don't even have lunch.
So Dan, remember that 10-minute well-being tip series? We have an episode on meetings because we know that they can negatively impact well-being, or if they're done well, they can actually create a positive source for us during the day.
Hmm. So you're looking at organizations and leadership through the lens of well-being.
Yes.
When leaders, first of all, what sort of pushback do you get from leaders when you start preaching this message?
I get a lot less pushback now than I got 11 years ago. That's for sure. And I certainly try to remain flexible and not come across as if I'm telling people what to do, because that's also, not good for their well-being or ultimately mine. I get a variety of pushback though, Dan, because well-being is a very personal thing. And this is a challenge for leaders trying to separate their own well-being journey from what we know to be true for organizational psychology and organizational behavior, and the research that should hopefully be informing our decisions about how we create a well-being culture. I used to get pushed back a lot for return on investment, but that has calmed down quite a bit because most leaders now recognize that well-being is much more about retaining talent and attracting new talent, uh, increasing team collaboration, increasing efficiency, decreasing our costs related to disability and people calling out sick. There's just so many other reasons to be engaged in well-being other than calculating a return on investment.
Mm. So the lens that a leader looks through impacts obviously the kinds of behaviors and things that they're leading people toward. In you would espouse, I assume, that leaders should look through the lens of wellness.
Always.
Oh,
Without our people, we have no organization. It's a in my heart, it's a fundamental practice because if even if our people stay, if they're not well, whether it's physically, socially, emotionally, then they are not going to be giving their best. They may not want to give their best back to the team or the organization.
mm, mm. On a personal note, I'm a farm boy from Maine originally, brought up on a dairy farm, and things like wellness and thinking right. That's for weaklings. And you work when you're sick, and you work when you're not sick, and you work when you don't want to, and you work when you do want to. I mean, that's just the way, that's the New England stoic sort of approach. Are you still feeling or sensing any sort of resistance to like the idea of taking care of yourself, or has everybody pretty much gotten over that?
I would say most people have gotten over that. I mean, I am not seeing that from the top of the organization or the bottom. I hate to call it, but the foundation of the organization. I am seeing it periodically in the middle. Managers have a tough job.
Mm,
They're having to manage up and down. And I think some of the people in the middle are feeling the pressure to produce, and that in their mind may mean working harder instead of rethinking the way they're working.
yes. So as people catch on to your message that use a lens of wellness, and I'm sorry, Rich, on is it okay? You talk at the beginning of the book about language here. I'm using the term wellness. Is
Sure.
that is that good or
That works for me. Yeah, I do mention, this discussion, is it wellness or well-being? And my message is, you know what? Whatever works for you, the spirit is the same.
okay? Right. Okay. So when you think about wellness and well-being, and starting to adopt it, this lens, what do you recommend to leaders? And I know your book is about culture, and perhaps that's where you want to
Yeah.
go, but what do you recommend?
Well, there is a well-being culture model that, when deployed, it will create the circumstances for your workforce to have a healthy and well day, including yourself. And so, without going into the six building blocks, I will just reflect on the leadership engagement building block. Now, leaders have a role in the five other building blocks, but there are some specific things that leaders can do to support health and well-being on their team, department, organization. And one of them we already talked about, and that's just being a good manager. All the things that you are working on, Dan, to make sure our audience is embracing. but more specifically, being a well-being role model. And that means practicing well-being during the day. And if your well-being practice is visible, let's say you decide to take a walk each day during the workday, that's great. If it's not visible, then at least share it verbally with people on your team so that they know that well-being and your health is important. The second thing I'd say is remove barriers to well-being. And you may not even know what the barriers are for the people on your team. So ask them, hey, is there anything that's happening at work that's getting in the way of you having a healthy day? And then work towards removing that barrier. The third thing I'd say is make well-being a priority. And this can come out in a lot of different ways just by putting well-being on the team agenda so that you talk about it in some form or another will give you an opportunity to show that well-being is a priority. There's several other ways, Dan. And in fact, there's a call out box in each of the six well-being culture building blocks, their chapters, that gives practical steps or tips for managers and how to lead with well-being.
So your book, Dr. Safir, is The Cure for the Common Company. You like to, and then there's a long thing on the end, like a byline, but
Yeah, yeah,
you like to say, well, no company is common. I think it's at the beginning there. You like to
yeah.
kind of qualify that, but you're saying, the common cold, or you're bringing some medical
Yes,
language there.
yes.
Yes. What in the world motivated you to endure this writing a book?
Yeah, just a note on this idea of the common company, and actually every company is unique. I will say though that as humans, we all have common needs, and that is certainly a thread throughout the book.
Mm.
Um, Dan, I have been very fortunate to have a lot of twists and turns in my career. And although I was able to see a path, I didn't realize I would actually get there. And now that I've been in this space of leading the employee health and well-being strategy at Johns Hopkins Medicine, I wanted to have an opportunity to share this with other managers, leaders, human resource professionals, and even people who do the work that our team does. Because all too often, I see organizations that want to do well by their employees, and yet they're taking an expensive and time consuming path that is not bringing the results that they're looking for. Often we quickly jump to physical health like nutrition or mental health like stress or you name it. And what I'm asking us to do is create a foundation so that we can support everybody's well-being journey. And I don't know of any other way to reach more people than to put this in a book.
Mhm. There's more telecommuting and working from home these days, and you would think that would be better for your well-being. What's your observation?
Well, everybody's different. So I can't speak to the listening audience as individuals today, but there are some well-being benefits, but there's definitely some well-being risks. I think everyone came to appreciate the value of being socially connected
Mm.
and physically close to each other during the pandemic. And I think we still, as a community, respect that. And that is the challenge of working remotely. It's not just about having those opportunities to brainstorm spontaneously. It's also about those spontaneous moments of connecting with individuals about things outside of their workflow.
Yes, yes. The human connection thing, it seems to be so important, and I actually
Yeah.
have got that feedback as well. And there was a lot of pushback, like I'm going to keep working from home forever, and Um, I mean, the flexibility is wonderful and people enjoy
Yeah,
that,
yeah.
they enjoy that part of it. But even like human touch, and I'm just curious about this with you. And this, I don't even recall seeing it in the book, but I mean, touching these days is a little bit of a touchy issue.
Yeah,
But pats and handshakes and
yeah, yeah.
the skin to skin, I mean,
Yes,
is really good. I mean, I'm speaking for
yes,
myself.
yes. We've always been told don't talk about politics in the workplace. We were once told not to talk about well-being or health in the workplace, and that has changed. There are ways to talk about it without coercing people to share their personal health information. And Dan, I would agree with you, and science would agree with you, that physical touch is important to our well-being. The question is, what is the acceptable practice in a workplace? And each workplace and each individual should have a say in that. For not just our the obvious, which is the legal ramifications, but also people have different levels of comfort with the different types of touch.
Yes. Yes. You made me reminded me of a speaker that I met one time, and he said, I just announced I'm a hugger, but he said, you're going to have to initiate. So if
Oh,
you meet me in the hall or you meet me at the book table or whatever,
yeah.
I'm a hugger. So feel free.
I might be in a lucky ecosystem, but a lot of people that I work with, or either at Hopkins or if I go to professional meetings, we'll just ask, "Hey, is it okay to shake hands?"
Yeah.
Or I've had people say, "Is it okay to hug?" And we don't have that invisible barrier. Like it's not an okay thing to ask.
Yes. Yeah. Transparency seems to help.
Always in so many different ways.
Yes. Well, is there another book in your future?
My wife says no. Um, I don't know, Dan. I have a lot of ideas about different books. Each of the six well-being culture building blocks could be its own book.
Yeah.
But I have to say, I am genuinely trying to maintain my own health and well-being. And writing a book really can take a toll in a lot of different ways. It was a great growth experience and brought me a lot of joy and fulfilled me in ways that I didn't realize the activity would bring. But it was also more taxing than I expected. So
Yes.
uh, TBD, Dan.
Yes. What authors are you enjoying? And I don't mean necessarily leadership books. I mean,
Yeah.
what are you enjoying?
Well, I've enjoyed books by the Heath brothers. I've enjoyed books by Daniel Pink. Um, I finished reading Leading with Gratitude by Chester Elton and Adrian Gostick, and now I'm close to the end of reading their book Anxiety at Work.
Hmm.
Um, and so I I really am blessed to have found so many books that are not necessarily about leadership, like Connected by Christakis and Fowler, and Blue Zones by Dan Buettner, that have influenced my thinking about how, as organizations, we can work together to create healthy and well workplaces.
Yes. Outside of leadership, literature kinds of books or reading that you do, what do you enjoy there?
Oh, I love being outside. I love outdoor adventures. When I
Yeah.
was younger, I used to go backpacking and camping in the outback. Now I go camping, but it's a little bit closer to parked to the car.
Yes.
Uh, I enjoy swimming. I do yoga, so I'm pretty active. I also enjoy spending time with my family.
Yes. Well, what is just a final word here, Rich, about your passion for well-being? What do you like to say to people that to help them catch your vision?
Well, what one of the phrases that came out of writing the book is well-being is a team sport. The idea is exactly what it sounds like. Most of us, when we think about our health, we think about how am I going to achieve the goal or the habit that I'm looking for. And we think about it like it's like for us to do alone. And that's really not the case. We're going to be so much more successful in having a healthy and well life if we ask the people around us, and that includes the workplace, to help us on that journey. Dan, you talked about connectedness a few minutes ago. Three of the six building blocks rely on different types of relationships in the workplace. One is between us and a coworker, a peer. The second is between us and our manager. And the third is between us and our larger team. Uh, it's I hope people read the book because it's just so fascinating how these different forces can support our health and well-being and how little they're appreciated.
Well, Dr. Safir, I wish you well with the cure for the common company, and your passion seems to be really coming to a point of very practical application these days. Like you said, when you began your journey, perhaps everybody wasn't quite as passionate about it, but after COVID and all of that, it just seems like falling off a log these days if you're not thinking about it.
Yeah, the companies that had already been on a good path prior to the pandemic obviously were in much better shape to handle the strain of the pandemic, and those that had not put pieces in place really deteriorated much more quickly.
Yes. Well, thank you for your time today and for the book. I I wish you well with the
Thank you.
book and with your passion as well. Thank you.
Thank you so much, Dan.
All right. Well, I just want to say again, on a personal note, thanks so much for taking time. I was very excited to talk with you.
I was very excited to talk to you, and this was one of the best interviews that we had that I've done in a while. Mostly because we mostly because we didn't talk about the book, and it's not that I don't like the book, but this just feels so much more authentic, and so I appreciate that.
Well, thank you for saying that.
Yeah,
And if I can serve you beyond, I think we're going to post something,
I'm
and
I'm gonna submit a blog. Thank you
yeah,
for the invitation to do that.
yes, and if I can do anything to serve you some way, please let me know.
Well, Dan, I appreciate that. And when you get the hard copy, because I know it's on our spreadsheet, and you have a chance to read it amongst the whatever number of books you're reading, if you think that it is a book that can help other leaders, obviously I would appreciate giving it some love in your vehicles. Um, I gave you the answer during the interview about why I wrote it, but I didn't just make a snap decision. I did some research, and people don't there's not a lot in this space, and there's definitely not a lot of training of leaders on how to lead with well-being. Dan, I it took me 3 years to convince our organizational development and learning department at Hopkins that we needed a program, and so I did one, and guess what? It was voluntary, and then after COVID set in, all of a sudden it became mandatory. And I now have four training programs for different levels in the organization. You talk about the pandemic causing things to respect well-being more.
Yes, things really ramped up.
Yeah,
And I think the language is changing, which to me it seems to be healthy.
yeah,
Just the result, you have to have results. That's not the question,
yeah,
but how you get results and how you think
yeah.
about work is such a big factor there.
Yes,
Yeah.
absolutely.
Well,
Well,
sir.
thanks for the work you're doing. I've been reading some of your blogs. I don't get to listen to as many of the recordings just because of having that time. But it's really obvious, I was about to say it's really obviously it's helpful, but and then I caught myself. Maybe for some people it's not obvious, and this is, but I think it's great to give people those chunks of
Mm,
information so they can
yes.
digest it that way.
Yes. Well, thanks for saying that. I have to tell you, people ask, it started getting traction because now it's like 12 years or something. I've written
Yeah,
like 4,000 articles or something, and it's like nuts. It's crazy.
it is crazy.
But people ask me, what's your secret? And I didn't know what the heck I was doing when I started. I just started doing it, and I wrote it for myself. I have a short attention span, so 300 words, that's pretty
Yeah.
good for me.
No, that's great. That's great.
Well, thank you for saying that, and
Yeah.
thanks for the book.
Yeah.
And I look
And I'll
forward
keep
to,
enjoying your blog. All right.
yes, thank you for that. Thank you for that. I
Oh,
hope
yeah.
that, I hope that I can be of service.
Thank you so much, Dan.
All right. Take
Be
care.
well.